Welcome everyone to today's webinar, Leveraging Data and Advanced Analytics to Optimize Procedural Supply Spend. I am Aaliyah Pavola with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. In about a week following the webinar, we will be sending all registrants a copy of the presentation to the email that you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Suzanne Champion has over 40 years of clinical experience in the perioperative setting. Since joining Cardinal Health in 2001, Sue has held roles as a pre-source field clinician, manager of the pre-source field clinicians, and as a senior manager with pre-source marketing. Sue is currently the director of clinical operations, and she has consulted on national and international accounts for clinical processes and practices, preference card management, supply chain, inventory, and equipment instrument management. Sue has developed and presented CE sessions pertaining to preference card management, inventory management, and various perioperative activities. Next, Sarah Reschke has over 14 years of healthcare industry experience, all within her tenure at Cardinal Health. Most of her career has been within sales, specialist, and leadership roles at the company. She has had direct experience within customer procedural supply chain and clinical areas while providing Cardinal Health products and service solutions. Through training and working with Cardinal clinical and logistical experts, she has developed a strong understanding of the procedural supply chain and is able to empower customers to improve their supply chain processes through product and process enhancements. Now, let's cover our objectives for today. After this webinar, we will hope you will be able to, number one, understand what predictable PAC pricing is and how it can aid in controlling procedural supply spend. Number two, see how developing a baseline to track historic versus current spend and scorecarding throughout the life of a PAC contract can provide measurable value. Number three, learn how capturing, managing, and transforming data to deliver insights can aid in highlighting opportunities for improvement in your PAC program. And four, discover strategies and resources available to increase clinical, supply chain, and vendor collaboration for sustained results. So let's get started. First, by telling you about the experience Cardinal Health has as a pioneer in procedural PAC program creation and management for surgical hospitals, ambulatory surgery centers, and large integrated healthcare delivery networks. To do that, we have Cardinal Health Solutions Manager Kendra Strother on the line.
Thanks, Aaliyah, and hello to everyone in our audience today. As mentioned, my name is Kendra Strother, and I'd like to provide a bit of background on Cardinal Health before we jump into the panel discussion. With more than 40 years of experience, Cardinal Health is a recognized leader with a top ranking for transforming the healthcare supply chain to meet new challenges around costs, revenues, and outcomes. Not only is Cardinal Health a leading med-surg distributor, we are a leader in the procedural kit packing industry. Cardinal Health has been manufacturing PACs for more than 40 years, providing relief through insight-driven solutions that empower healthcare providers to take control of their surgical supply chain and clinical practice. With that, let's jump into our discussion. So one challenge that seems to be all too prevalent with PAC programs is price creep. PAC costs that seem to grow year over year, leaving supply chain professionals and clinicians with budget responsibility feeling a loss of control. It can be tough to defend spend, and PAC pricing practices are often opaque and confusing, and it's just hard to tell how PAC prices are derived sometimes. Providers want transparency, and there's a concept called predictable PAC pricing. Sarah, can you articulate what predictable PAC pricing is and what the benefits are for the audience?
Sure, Kendra, and it's really no surprise that providers want transparency. I hear it all the time as I talk with customers. PAC pricing shouldn't be a mystery. It really should be reliable and simple. Pricing without justification can prevent providers from capturing the full value of their PAC program. So price models ultimately provide visibility to pricing at the component level. So there's a clear understanding of how the total PAC price is calculated, with the ultimate goal of providing transparency. And one price model doesn't fit all, just like one PAC doesn't fit all procedures. And over the years, pricing models have evolved really to address the needs of our various groups of customers, including hospitals, integrated delivery networks, regional collaboratives, and group purchasing organizations. And with the visibility to component level prices, leaders can make more informed decisions with upfront insight into what the financial impact is for each of their PAC change considerations. Sue, you've managed a budget before. What's your perspective?
Well, you know, Sarah, when I was a manager responsible for a budget in the operating room, there were times where it was never clear how my PACs were priced, and if I made changes to them, how that impacted the bottom line truly. Now having a predictable PAC pricing model, it helps to streamline the process for creating new kits, so you understand everything that's going into that kit and what your price would be. But also it makes it so much clearer when you have an understanding of changes to PACs that you currently have. It allows you to be able to wear both hats that an OR manager has. You know, we have the financial hat because we have to align to our budget, but we also have to align to the clinical needs. And trying to tie those two together at times and come up with a good financial and clinical practice, that's very difficult. So with the predictable PAC pricing, it at least allows the ability to see what those clinical decisions are and how they impact the financial bottom line.
Thanks, Sue. So PAC changes tend to be relatively frequent for most providers, whether they're adding products, removing products, creating entirely new PACs, discontinuing PACs, whatever the case may be. It's tough to track the value associated with these changes. And there's usually rationale behind the change, but again, it's tough to measure the value. So Sue and Sarah, I'll ask you both, how can PAC providers demonstrate the value they provide to their customers?
I'll start, Sarah. And I want to remind everybody why PACs were brought to the market in the first place. They really were designed for the operating room to help improve efficiency and save on the labor costs when you're preparing for your surgical procedures. As we all know, there are so many single sterile items that you can pull for a procedure, so kitting made it possible to be more efficient in that regard. It reduces your case pick time and ultimately your case setup time. And we know that case setup time is directly relatable to your OR time and what that money brings to you, because OR time minutes are money. So in PACs, when you think about it, they are a very large portion of your budget. You have this overall budget, but your one with your PACs in it, that's probably the one that stands out the most. So if you're a large integrated delivery network, think about how many kits you may have across your network. You can have up to 100 unique medical and surgical PACs. Imagine the touch points and the movement of product in and out of each of those kits, plus the ROI that's associated with the newly created and the retired kits, because sometimes your procedure mix changes, so you don't need an existing kit anymore. That is a huge amount of data and information to track and manage. You know, a wise man once told me that you cannot manage what you can't measure. You have to be able to measure what you're doing with your PAC programs. And you have to be able to quantify those touch points, because ultimately there are dollars there. So the key to measuring value of any PAC change and eliminating touch points is to develop that baseline. You have to know where you're starting, because how do you know where you want to go if you don't know where you are? That is so very important in today's business.
Sue, you're absolutely right. And baselining is really a way to understand your organization's historic spend versus the current spend. And a baseline is that starting point to compare a current procedural supply cost to the new procedural supply cost after you've made a change or created a new PAC. Not only does that baseline account for your procedural supply cost, it also shows what you were talking about in those touch points and the touch points that are reduced throughout the supply chain. If you think about it, a touch point occurs with every touch, in quotes, of a product throughout the supply chain, whether that's ordering, receiving, stocking, picking, or even opening a product for a procedure. There are costs associated with the touch points as they move throughout the supply chain. So that baseline is really a means to demonstrate your program efficiency while keeping procedural supply costs in check. Let's take a look at an example. Here, we're looking at a lap chole procedure, and this particular customer performs 150 lap chole procedures per month. And we've done an analysis working with this provider to understand that their current procedural supply cost is the combination of all of these items they're pulling. They have an existing lap chole PAC, and that costs $50 each. They're also pulling a cautery pencil, which is $8 each, insufflation tubing at $5 each, an additional surgical gown at $3 each, and a 4-pack of OR towels at $2. So their total procedure cost is $69 each for an annual cost of $124,200. If we take a look at moving those single sterile items and shifting them into bulk non-sterile items to be sterilized inside of a new lap chole procedure in a revised PAC, that cost is $64.50 each. So that's a procedure savings of $4.50 each, annual savings of $8,100 or 6.5%. And if you add up those touch points, you're reducing 7,200 products from the supply chain. All those dollars really add up. Makes a lot of sense.
Well stated, Sarah. Thank you for that. And just to be clear, you could have several baselines by PAC, department, unit, and that's, again, a lot to manage. So how should providers track and aggregate these baselines with the help of their PAC vendor?
Well, Kendra, that's really straightforward with a scorecard. When we talk about scorecarding, you mentioned every PAC change that can become a lot to manage. So a provider and a PAC vendor can be tracking these changes through a scorecard, and really it's to quantify the value of that change. In the example I just provided, we were adding 4 additional items to that PAC. So being able to track those dollars on every revision is really helpful for a provider, because every time they're tracking a change, they're able to calculate what the savings are, and it's defendable by that baseline. So every revision can then be aggregated on a scorecard as it's ongoing, and that really demonstrates the value of your kitting program, making sure that, again, you're managing to that current and that proposed procedural cost. And so at times, PAC vendors will identify savings that providers may not be able to take advantage of at the time. So by maintaining that savings scorecard ongoing and reviewing that with your kit vendor on a weekly or monthly or maybe even quarterly meetings, you'll have an understanding of what saving opportunities are really still out there, and they might still be available. And so if your circumstances may change, then and the provider is ready to take action on that item, they can go ahead and take advantage of the savings that are on that scorecard.
And you know, from a director's position, when you have this scorecard, anytime you need that information, it's at your fingertips. We all know as managers that there is somebody always questioning that budget. I talked about before how your PAC budget is typically one of the largest items in your overall budget. So people will come to you, and there are times that it's challenged. And they want to know, why are you spending so much on your kits? How is that helping the facility? And you're able to defend what you're doing with your PAC program. You can refer to it to demonstrate the continuous improvement that you and your staff are doing at all times, and also to show either by department or service or down to a provider level how effective your program is supporting your procedure mix. You know, a well-maintained and manicured program makes the day-to-day operations run so much more smoothly. And but it doesn't come without work and collaboration between the stakeholders in your facility and also your PAC supplier. Sarah, could you walk the audience through an example?
Absolutely. Here we're showing a couple of examples, and Sue, you mentioned by department. So let's dig into a couple of examples in two different departments. Here we have an operating room, and we've got some activities along with the identified savings, achieved savings, and the achieved date. So each of the activities listed here, the first one is a conversion to a bulk non-sterile cautery tip. If you think about the lap chole example we talked about, that was a cautery pencil. Well, in this example, the customer is single pulling a cautery tip off the shelf, and they're adding it to a procedure pack. Rather than adding a single sterile item, we have the advantage to sterilize the components all at one time. So in this example, we've got some savings here. So the savings by moving a single sterile item into the packs is $2,800 annually. And this customer achieved those savings because they took advantage of the opportunity. So it's $2,800. The next one is a conversion to a regular duty back table cover. So this one may be a heavy duty back table cover that is perfect for your orthopedics or those cases with some heavy instrument trays, but it may not be required for every procedure. If you think about a cystoscopy or even a delivery pack, those procedure packs may not require a heavy duty back table cover. So this example is the conversion moving from that heavy duty to a regular. The kit vendor identified $6,600 in annual savings by making that change. And this customer took advantage of $1,800. And again, there may be a reason for that. Maybe they're going through a transition and now it's not a great time for them to make that change to their procedure pack. But we want to continue to showcase those savings opportunities in case something changes down the road. Looking at labor and delivery, here we have a conversion to preferred towels. Many of the kit vendors will have preferred or self-manufactured components that are available to providers. And in this case, the customer was presented with an opportunity to take non-preferred towels to a preferred vendor. This was an annualized savings of $8,000, and this customer took advantage of majority of those savings and achieved $6,750 annually. Then at the bottom, we want to take a look at what the aggregate savings are for this particular facility. And between the operating room and labor and delivery, we've got our identified savings total of $17,400. That's annual. And then we have the achieved savings of $11,350. All those dollars will add up and continue to grow as the provider and the kit vendor are partnered on developing the scorecard and maintaining it. So if you think about it, the scorecards can really be generated to pull all the value of the PAC changes and activities within a department, all of the departments, as in this example, that can show at the facility level. And if we take it a step further, we can actually take this facility and say they're part of an integrated delivery network. We can add this scorecard with the other facilities in the integrated delivery network and get a complete aggregate savings total across the IDN. So those facility level scorecards can all be summarized and showcase the value of each PAC program at each of the different locations and at the corporate network.
That's great. Thank you, Sarah. And scorecarding really is a powerful tool, just based on the example you showed previously. So when you start with a baseline, you can quantify the value of the changes within your program, PAC by PAC. And then from there, you can see how each opportunity presented by your PAC vendor and the activities you engage in together add up, which is why the scorecard is so helpful. And one thing to note, these activities shown on the screen don't happen in a silo, right? There's a time investment on both the provider and the PAC vendor's part. And the scorecard helps to track the value associated with that investment. So once you have a well-manicured program, you know what value your PACs bring, and you know what savings opportunities you can take advantage of. And then you also know how far you've come in terms of executing against those opportunities. And so I imagine you can do a ton with the data and get creative. And so with that, let's talk about leveraging data a bit. What data can PAC providers use to develop insights or trigger that aha moment for providers to help them spur meaningful change in their organizations?
So I'll jump in first. Kendra, as you mentioned earlier, Cardinal Health has had over 40 years of kit packing experience. And there are several PAC vendors in the industry that have been around the business for a while. And with that scale, as you can see on the slide, we've covered over 4,000 customers, and we produce several kits each year. So that scale adds up to the amount of data that we're actually able to collect. And it's really a data-rich environment. If you look at the map, each of those dots, the red dots represent the customer we serve in North America. And so what we've done is we found a way to harness all of that data, pair it up with industry data to help benchmark and make targeted recommendations to spur action and drive value for providers. Really, any tenured PAC provider can do just that. Effectively manage and aggregate the data from each served customer behind the scenes, use algorithms to uncover anomalies and opportunities for you. And once the opportunities for improvement are presented, then you can have cross-functional dialogue within your facility, and that all helps turn those insights into action.
So, quick question. What sort of actions could a provider take with this data? And Sue, I'll ask you if you have any thoughts to share.
Sure, Kendra. And you know, there is so much that you can do with this data. And the great thing about it is you can align it with your facility or your IDN's priorities and your strategic initiatives. Perhaps you want to look at standardization. And we all know that standardization means something different to everybody. You can standardize your componentry that's used across your facilities or even just within one facility. But you can go beyond just components. Then you can look at your PACs. Is there a reason to standardize kits? Are there commonalities and similarities, or has your procedure mix changed? And so you want to look at your kits and standardize to make sure that you have the most efficient program supporting your mix. Another thing that you can do is you can standardize across an IDN if you're part of that IDN, or even a GPO. So standardization is one part that you can do with that data. Another one is think about looking at how you're tracking against other facilities or even benchmarking against other providers within your network. So you can use it for benchmarking and look at your GPO information, your IDN information, and even compare it to the nationally ranked institutions. There's lots of data out there that you can see what other folks are doing with the same procedure mix, same facility size as you, and then take your data and compare it to make sure that you are tracking the way other people do, because that's what's driving efficiency, driving dollars, and ultimately driving your ability to provide quality patient care. Then back to one thing that's specific to the operating room, preference cards. And I can see and hear everybody taking a deep breath anytime we mention preference cards, because they are a beast. They are difficult to manage, and you have to keep your eye on them constantly. So the data that you can get from your PAC provider will help you with those preference cards. You've made PAC changes, and if you are driving supplies from the shelf into that kit, that single sterile supply more than likely was on your preference card and does not need to be pulled anymore for the case pick. You have to be able to leverage that data to know how to manage your preference cards. You take items out and all of a sudden they're not in the kit anymore. You need to reconcile so that you know that it will be pulled for that next case. So you can use that data for preference card management. One last aspect that you can do from a clinical perspective is use that data to look at your clinical practices. Are there ways to improve what you're doing, standardize your process, make adjustments to your practice so that you know that you are doing the most efficient processes, and also from a labor standpoint and also a financial standpoint.
Great. Thank you, Sue, for that. So to pull it all together, in this short amount of time, we've covered a few things. We've covered predictable PAC pricing and its benefits, and it's really just understanding how your PAC price is derived. We've also talked about baselining as a way to understand changes in your procedural supply cost when adjusting or creating new PACs. And we've also covered scorecarding, really as a means to aggregate all of the individual PAC changes by department, facility, and even at the network level. And so from our perspective, here's how providers can take action on what they've heard today. So to everyone in the audience, don't be afraid to challenge your PAC vendors and hold them accountable for providing you opportunities for continuous improvement. And as Sue mentioned, you can't see what you can't measure. So share your concerns, your challenges, and supporting information to help your vendor diagnose and provide the right solution for you. And remember, baselining from the start of an engagement helps you to estimate the value of the changes before you implement. Create a roadmap together. Engage the other stakeholders in your facility and just pick a service or a department to focus on. Start small and make incremental progress. Also, you can create SMART goals, right? Those are specific, measurable, achievable, relevant, and time-bound goals to stay on track. And request a scorecard from your vendor if you don't have one already, because that'll help you track the aggregate value of your PAC program.
Great. Thank you, Sue, Sarah, and Kendra for that fantastic presentation and for sharing your experience and commentary. I'd also like to thank you, our attendees, for your attention. Please take a moment at the conclusion of the Q&A, once you exit the webinar, to complete the survey that will pop up. Your feedback is invaluable in helping us continually improve the value you receive from discussions such as this one. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. There are already tons of questions flowing in, so we will get started. The first question comes from Jill, and Sarah, I'll direct this question to you if that's all right. She asks, when is the right time to ask for a scorecard from my PAC provider? How far back will the scorecard go?
Well, Jill, really, you can request your savings scorecard at any time. And if your local sales representative has started a scorecard, that's great. And if they haven't, then just start with where you're at. And really, best practice is to start a new scorecard at the beginning of a new contract cycle or a renewal, but anytime's a great time to start.
Great, thanks for clarifying. The next question is from Jacob, and Sarah, I'll direct this question to you as well. He asks, how can data and analytics help us drive standardization and realize tangible results?
Well, I can help you, Jacob. So there's data everywhere, and really you need a PAC provider and distributor who can help you aggregate it and use it to aid in decision making. So something as simple as using your own distribution purchase data, for example. You can use that to identify some common products for standardizing across your hospital or health system. And the data analysis will answer any of those questions like, what are you using now? Where are the opportunities to consolidate these items? Just to name a couple. So product standardization can really drive new efficiencies as well as cost savings. I know providers are always looking to reduce SKUs. And so you can also have some savings as it comes to that. So you've got common products, and you also have kit components that help you leverage volume purchasing power and potentially earn more advantageous rebates, depending on the situation that you have. All of this can really lead to lower product costs. And I mentioned you can decrease the SKU count, but really it's about having the right SKU count, making sure that you've got an optimal amount of components available to you. And all that's helpful to minimize waste and reduce your inventory on the shelf. So these are a couple of things that can improve efficiency and help you with your overall cost savings goals.
That's a great answer, thank you. The next question comes from Alice, and she wants to know, how do you use data and analytics to work with your teams or the surgeons to gain understanding and buy-in for positive change? Sue, can you take this one?
Sure. You know, Alice, I probably don't have to tell you that change is difficult, regardless of whether it's positive, negative, or whatever it is. Change is just difficult. So using data and analytics is a plus, especially when speaking with your surgical staff. I'm sure I don't have to tell you that surgeons and clinical staff tend to be very analytical. They don't want the anecdotal, you need to change because this is what I think is happening. If you have data and analytics behind you, it helps to show that you have actual data to show them and say, here is what we see based on usage of product or practice, and here is what we need to do based on what our strategic goals are for the facility. And anytime that you have analytics to help back you up, it tends to lead to better buy-in. It still doesn't make the change easy. I'm not going to sugarcoat it, but it allows you to have that conversation with your staff that helps, and you have data behind it to support what you're saying. And you know, the staff, they appreciate hearing and seeing the hard facts so that they have an understanding of what their practice is doing to the overall financial health of your facility. And it helps them to understand where you're trying to go. And gaining that understanding and buy-in before you start any product or any process, sorry about that, it's not just a nice to have, it's a must-have. If you don't have buy-in, that means that you try to enact change and then you put all this effort forward and sometimes it goes nowhere because you didn't get the initial buy-in. Analytics helps you make that first step.
That's helpful to know. Thank you so much, Sue. And I'm going to direct the next question to you as well. It comes from Steve, and he asks, can you talk more about benchmarking and how data can help with that?
Sure, I can give some ideas on that one. You know, once you have the data and you interpret it, you can see that best demonstrated practices start to emerge. And you can also validate it. So once you have it on paper in your data, you can go out there and start watching what's really happening, because data tells a story, but you have to corroborate it with actual interviews and observation of what's happening. So say you want to review PACs within one procedure type. You can go out and watch those procedures and then assess the time that it's taking to set up and perform, and then turn over that room from that procedure when they're using that particular PAC. This is where you can start to see how efficient the PAC and your process is for supporting those types of procedures. You can also use it for when you're comparing PACs so that you can see, and I'll say in quotes, normal and efficient your PACs are. And that ties back to having all of the items that are readily accessible in your kit. Is it really supporting the procedure mix, and is it really supporting the practice that you're doing at your facility? Perhaps there are some items that you're still pulling routinely, and those can be moved into your kit to drive even more efficiency. And if you think about benefits of a well-designed PAC and how it impacts your OR time, you know better than I do that quicker room turnover and setup time for the next case are actual dollars within your budget. Time really is money in the operating room, and we all know the value of that OR minute. And so benchmarks and comparisons help you to understand the opportunities to make you better and a better use of your operating room time and also your staff time. Because remember, labor is that biggest line in your budget also.
Wonderful. Those are great points. So here's another question, and maybe both Sarah and Sue, you can address it. But the next audience member wants to know, if I challenge my PAC provider as you recommended, what's that going to cost me in terms of time, money, resources?
I'll start. Well, there is a time and resource commitment. So if you think about it, data sharing is an investment. It takes time and people to help you get after the data in the right format. And if you want actual results and not estimates for those identified savings we were talking about earlier, then there has to be that willingness to reciprocate with data. It's beneficial for you, and there's less rework to get to the true value. It's also beneficial to your PAC vendor or distributor because then they can confidently use and interpret the data.
And you know, if you look at it from the perspective of once you have that data, how do you start to jump into the creating solutions? And say your solution is tied to standardizing products. You have to spend time looking at and getting that buy-in with your teams. That is the biggest portion of the time allocation that you'll use. First, you have to decide what resources are needed, allow them the time to do the job that you would like them to do, and then take the time to prepare them and get the buy-in. Let them understand where you are and where your vision is of where you want to go. If you don't take that prep time and getting the team together and making sure that everybody is on the same page, then your implemented changes you're trying to do won't go over very well. And you really will just be spinning your wheels. We've all been there, I'm sure. I know I've been there as a director. You start a program, you start a project, and you really didn't do all of the prep work. And all of a sudden, you just see it falling apart, regardless of how much work you're putting into it. So from an expenditure of resources, it's the folks that are directly tied to whatever practice you're trying to change, and then allow them the time to really make some positive identifications of solutions and to help work towards those. So while it does take some time, it really is beneficial at the end.
Great. Thank you both so much. The next question is from Will, and it's about pricing. He wants to know, on your predictable pricing slide, it read model dynamics under new PAC. He wants to clarify what are model dynamics.
Sure, I'll take that one, Aaliyah. Well, price model dynamics are the mechanics of the price model. So aside from the component pricing, there are other costs associated with assembling a procedure PAC. just like there are other costs associated with picking for a procedure, right? So there's labor to put the pack together, and then also the sterilization charges. And I mentioned earlier, one price model doesn't fit all, and that's really true. So the pack vendor can actually modify the model based on what the customers are really interested in seeing, with the goal of providing transparency. Hope that helps.
I think it does. Thank you for clarifying. So there are a couple more questions coming in on scorecarding, and the first one is, what are some of the activities that can be added to a scorecard?
Shirley, I'll take that one too. And thanks for the question. So activities are really the opportunities that the provider can take advantage of. And that's really to save or to enhance efficiency. An example might be of an activity where there's a component conversion opportunity to a lower cost alternative for some PAC savings. And in the example we used, that activity was moving from a sterile to a bulk non-sterile cautery tip, or moving to the preferred towels that I mentioned. In both of those instances, really the PAC vendor could have better costing, which can present a savings to the provider with that conversion. Another component conversion might be moving from that heavy duty back table cover to the medium duty back table cover that I mentioned, right? And so that's really dependent on the procedure type, and that don't require those heavy duty. And that really does drive some savings because you've got an over-engineered back table cover. So those are some activities related to conversions or component changes. Other activities could include maybe a new pack creation. So Sue mentioned earlier, retiring certain procedure packs that are no longer in use and introducing a new pack that is now going to be of use with your procedural mix. That's really where a baseline can come in handy because obviously you're able to document the cost benefit. Other activities might include formal engagements within a facility, such as a program review, either led by a rep or even if a clinician came in, or even conducting a standardization exercise. Does that clarify?
I think so. Thank you so much. So the next question is from Ashley, and it pertains to insights. She wants to know, what type of insights have you helped your customers uncover?
I'll take that one. There's lots of different insights that can happen for a customer, and they have that aha moment. And it depends on how they've been using their data up to this point. Doesn't mean that they haven't had the data, but sometimes you can look at it differently and have all of a sudden that light bulb goes off. If you think about it in your kits, say you have multiple vendors of the same type of component in your pack, let's say suction tubing. And for whatever reason, you have two different vendors of the suction tubing in all of your kits across your facility. And maybe that happened because you have to make that aha moment and say, well, we created this from off-the-shelf items. And so you go back and you look on your shelf, and all of a sudden you realize you have two different vendors of that suction tubing on your shelf. How did that happen? There's lots of different reasons for that. It may be that there was a change in contracting for that component, either a local contract or with your GPO, and there was still some left of the old component and it stayed on the shelf. It has its own living space on your shelf, and somebody never quit ordering it. And all of a sudden you have those two components. So that's an aha moment, saying that if you look at it from a component standardization viewpoint, you need to maybe look at everything and make sure that you don't have redundancy in your vendors when it's not needed. You can also look at it by procedure. The vendor can tell you what opportunities are available to standardize your products, and then you realize that you've had multiple products once again in your kits. And they also can help you start with the standardization effort, and you realize, wow, I really am not standardized, and I thought I was. on the surface, you all thought you were standardized, and the staff did also. But when you start looking at it from a data perspective, that aha moment happens and you go, oh my goodness, no, I'm not. Because when I do this in this service, I'm using these components. But when I work in another service, we're using the same type of component, but they're from different vendors. So those are the aha moments. Sometimes they're big, sometimes they're little, but at the end of the day, all of them allow you to make decisions that drive efficiency and drive cost effectiveness for your program and your facility. I hope that answers your question.
It does. Thank you, Sue. That concludes today's presentation. I want to thank Sue, Kendra, and Sarah for their excellent presentation and Cardinal Health for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.